Will the slides just come up? How do I go back? Okay, sorry. Hi, everyone. It really is an honor to be here, and especially because I respect so many people on this panel. It's sort of humbling to sort of be here. And I think one of the nice things about all of the tools that you'll be hearing about is that they are people-centered. It's going to where people live. It's being culturally competent, and I think all of those things are really important. And I will say that I have played the Gift of Grace now, hello, and it actually is really fun. But I'm going to tell you about Prepare, which is an evidence-based online advanced care planning tool. And in terms of why sort of did I create this? So I'm a geriatrician and I'm a palliative care physician, and I've worked for probably the last 15 years with disenfranchised populations. So individuals who have limited literacy or limited English proficiency, and I cannot tell you the profound lack of empowerment that patients or people find themselves in when they're in a medical crisis. And I think we've heard also with their caregivers a profound lack of empowerment and thinking about what could we do to sort of prevent these things. And I will say, and as Stacy pointed out this morning, I spent a lot of time thinking about how could we start with advanced directives and making those easy to use. So we spent years sort of working with our community, working sort of with and for and by the community to create these easy to read advanced directives, which are written at a 5th grade reading level. We tested them in a randomized trial, and yes, we were shown that people preferred them, that we doubled our completion rates. And I think the interesting thing about this is that even people with very high literacy prefer these easy to read forms. Because when you're dealing with something that's emotionally difficult, you want it to be easy to read. So early on in my career, I thought, well, I created these advanced directives and they're easy to use and people are using them. So great, I have solved the advanced care planning problem. We can just sort of move on, and this is great. So these forms have been available in California for now, I think, over 12 years. They're in 10 different languages, and they're available for free. But I think as we started doing more formative work, and again, continuing to talk to our community, and my own personal experiences as a physician and in my own family, really sort of realizing that advanced directives are not enough. And I'm going to read you a quote from a surrogate from one of our studies. And she said, "We got the DNR in writing, but in making the decisions, which there were many, that was just one. Because the first decision was to put him in a nursing home. We were married 30 years, and I could no longer take care of him. Then the second decision was whether to put him on a feeding tube because he had stopped eating, and I wasn't ready to let him go." And I think oftentimes when we think about advanced care planning, we think about one decision about end of life. But again, as a geriatrician, my patients and the family members that take care of them are making many decisions over time, and people need support for that. So really thinking about really what is this missing puzzle piece to advanced care planning, and it's preparing people with skills to identify what is most important to them and how they want to live. And I know that sounds maybe easy to us in the audience, but I can tell you that's actually hard for a lot of people to do. Then how do you communicate that with loved ones, and how do you communicate with your providers? And then how do you take what you know is important to you and translate that into medical care? Because I'll tell you that as clinicians, oftentimes we expect patients to be able to do that, and that's a hard task to do. So our solution is an interactive multimedia website called Prepare for Your Care. It sort of walks people through an easy 5-step process. This was really set up so that people didn't have to do this all at one time. People can do one step at a time. People can do what is most important to them, but choose a medical decision maker, decide what matters most in life, choose flexibility for your decision maker, tell others about your wishes, and ask doctors the right questions. And I think, the cornerstone of this really, when you go back and you think about how do you get people to change their behavior, you have to actually model those behaviors. So telling somebody to do something is maybe not going to be good enough. And so not only is the website written at a 5th grade reading level and is easy to read and has voiceovers of text and closed captioning, but really the cornerstone are these videos that show people how to do something. So how do you ask somebody to be a medical decision maker? how do you tell other people about your wishes, especially if you have a large family, and how do you bring these things up? How do you ask doctors the right questions? And as people are going through sort of the website, they're able to answer sort of values and goals and questions about themselves. And not only, we have sort of the checkbox sort of answers, but we also have sections where people can write their own stories if they want to. So really sort of the rich background about who they are as a person, how they want to live, and what their preferences are. So we showed in a pilot test that Prepare does improve patient engagement in advanced care planning. So this was a pre to post test. We went into low-income senior centers in San Francisco. The mean age of our participants was 70 years. And interestingly, 92% of these people had never used a computer before. So these were chronically ill, disenfranchised older adults with chronic illness, and only 40% of them had engaged in some form of advanced care planning. And then 1 week after viewing Prepare, that increased to 100%. And again, these very computer naive individuals rated the website a 9 out of 10 for ease of use. So then we went on to we're actually doing several randomized control trials. I'm going to tell you about the first trial that we did, which was in our VA hospital. So this was a randomized trial, and this is what we're calling a patient-facing only trial. And what I mean by that is we wanted to know, I think in order for advanced care planning to be successful in the medical environment, you need many things. You need EMR transformation, you need education of the clinicians, you need education of the workflow staff, and you need things for patients. We wanted to know how much bang for your buck could you get if you just gave patients something. And if you gave patients something, would that activate clinicians to then do what they're supposed to do, which is to ask these questions and to document this information? So what we found, actually, and another point to make about this when we're thinking about studies, people have asked me, well, why didn't you just have a control group where some people got nothing? No advanced care planning. And I think the thought in the field is that, it's sort of unethical to not give people something because we know advanced care planning works. So we don't have a control group, but I can tell you that 6 months before our intervention, the advanced care planning documentation rate, this is in the chart review, objective chart review, was 1%. And then when we gave our easy to read advanced directive, documentation in the medical record went up to 25%, and with Prepare, that went up to 35%. So we actually have done audio recordings of those doctor-patient interactions, and we're starting to look at what was it about those things that maybe activated people to bring this up and get people's wishes into the medical record. So I think, I share sort of the sentiment of many people on our panel. How do we get this out to where people live, and how can we make this easy to use? And so one of the things about Prepare and the design is that, yes, people can go through it and it can be interactive, but for those people who maybe can't do that, we wanted to sort of create something where they could watch it like a movie. And that has really sort of helped us figure out how we could actually get it also out to the community. So we've created toolkits that provide everything from the newsletter or the email or the poster or the things that somebody could say if they were going to start these conversations. And to be able to use these, again, just like the Conversation Project in libraries, churches, and senior centers. And we've started to do some of this work and gotten very positive feedback back. So close to 100% of people that review this, again, wind up going on to do some advanced care planning, would recommend this to other people. And again, I think this is a good way to get it out in the world. But I think one of the other things we've been thinking about, and it's interesting to sort of span, like my heart is in the community. And I can tell you when I created Prepare, I didn't care, I learned all this stuff about advanced directives. I wanted people to talk to each other. But then you go talk to people in the hospital and they're like, but where's the form? Like we need to have some sort of bridge back to the medical world so that we can make sure that we do honor those wishes. And how do we do that? So a lot of people were saying, well, you created this advanced directive. Could you somehow wrap it into Prepare so that you can kind of close the loop on the medical piece? And so we were lucky enough to get funding from the Gordon and Betty Moore Foundation. We're working with our legal colleagues at UC Hastings to actually update and translate our easy-to-read advanced directives for all 50 states. And we're really sort of excited about that, but not only to do that, but to integrate that into Prepare. So once you've answered all of these values and goals about yourself, maybe you've written down stories about who you are, that those things can be actually included into a legal document. And hopefully, again, to increase our chances of honoring patients' wishes. I think one of the other things that we're sort of thinking about and working on is sort of bridging, again, wishes into the medical record. So we've gotten some family foundation funds to sort of work at UCSF. You know, there are many different electronic medical records, and that's what makes it so hard. In terms of Epic at UCSF, there are ways that we can sort of work with MyChart and patient messaging, again, to get this out to people, but then sort of bring it back into the electronic medical record. So with that, I will end. Thank you.